My name is John McClellan. I'm an orthopedic spine surgeon at the Nebraska Spine Hospital. I'm orthopedically trained with a subspecialty in both pediatric and adult spine surgery. Born and raised in Omaha, Nebraska. What led me to become a spine surgeon? I attended Creighton University Medical School. Graduating, went to a combined orthopedic program between University of Nebraska Medical Center and Creighton University. I still consider it one of the best training programs in the country. After the orthopedic training, I went to England and trained under John Webb as part of the National Health Service in Nottingham, England. Experience at Creighton was incredible. I was able to train under a surgeon named John Brannigan, who was the pioneer and actually invented the intervertebral cage, which is used around the country by all spine surgeons. And I was able to do some research with Dr. Brannigan and watch his techniques. It just encouraged me to follow in their footsteps. I saw their careers and I saw how excited they were about their jobs. And ultimately I saw there was a lot of room for improvement in spine surgery. It's really a specialty that has only developed in the last 20 years or so. What I enjoy most about being a spine surgeon is really the people we meet. I've been doing it for 23 years, and some of my favorite stories really aren't necessarily the surgeries that we've done, but the stories that you hear from the patients that you take care of. You have to listen to the patient and understand why they're there, how it's affecting their lives, and then based on that try and come up with either a conservative or a surgical option for them. It's a lifetime relationship with patients. What sets myself and my partners at Nebraska Spine and Pain Center apart from other surgeons, patients tell us that we're good listeners. We have a team approach. You're not just seeing myself in clinic, you're seeing my partners. When you walk into this office, you feel like you're walking into a restaurant that you've gone to your whole life. For many years, been the group that does the very complex procedures. A lot of patients travel here for second, third opinions, or for opinions when they've had a procedure that hasn't gone well. Not only work well in our community, but we try and work well with all providers across the state that are providing spine care. We try and work as what you would consider a treatment team. We try and have solutions for patients regardless of what level of care they need. Really has incredible power when you're trying to help patients to get through some of the pain and troubles they're having with their spines. The advice I have for patients that are considering spine surgery is really making sure that patients understand what's necessary to heal the surgery properly. Some surgeries require no time off work. Others might require a month or two off work. If the patient follows those restrictions, their chance of a very successful outcome are dramatically improved. I think it's also important that patients take time to attend to the personal side of healing. When you take a patient out of work for a couple of weeks or even a couple of months, it's extremely traumatic emotionally. And so you not only have to really make sure that you've accounted for notifying your work, telling your family what type of help you'll need, but also making sure that you're setting yourself up emotionally and physically to come out of it strong. There are a lot of misconceptions about spine surgery. The most damaging misconception is that a person should never have spinal surgery, or that it should be considered as their last option. You identify termites in the deck outside your house. Do you decide to treat it right away when you identify them? Or do you wait until the termites have destroyed the whole deck, or do you wait until they're in the house? It's important to visit with a spine specialist early on in the process to really understand how serious your condition is. What sets Nebraska Spine Hospital apart as the best place for spine surgery in the region revolves around three main items. Number one, it has the most advanced surgical techniques and equipment. Number two, it's by far the safest spine specialty hospital in a several state area. And number three, the nurses, the medical assistants, and all the people working at the spine hospital are the world's best, bar none.